Hello, I am Dr. Stalin Ramprakash. I am one of the pediatric hematologist, oncologist and bone marrow transplant consultant. Today in this video, I am going to talk about childhood cancers. If you are watching this video, it is possible that either your child or one of your child known to you has been diagnosed with cancer. One of the first questions which comes to the parent's mind is that, why did my child develop cancer? How it happened? Cancer is a condition where some of the cells in your body are dividing out of control. Normally, the cells divide in a very controlled fashion. If your body needs more cells, the cells divide. If they don't need, then they stop dividing. Whereas cancer is a situation where the cells do not follow the normal rules. They are on their own, continuously dividing and becoming more and more, and they can start invading other parts of the body as well. And thereby, eventually, if you don't treat it, they go out of control and even they can result in death. Why did this happen? This is because the cell multiplication is a very controlled process, and that is controlled by the genes. When one cell becomes two cell, all the genetic material in one cell has to be copied into the next cell. This is a very orderly process. The amount of genetic material is quite large, and this is a lot of information. You can imagine like you are copying some, say, 23 pairs of volumes of big books of this size, and all that information has to be copied perfectly without mistake. Sometimes mistakes do happen. When the mistake happens in critical genes which control the cell multiplication, that is when the cell goes out of control. And that is what we call as a cancer in simple terms. How common is childhood cancer? Childhood cancer is a rare disease, but still it can happen to anybody. So if it has happened to one of the child known to you or your child, it is unfortunate, but with the modern medicine, this can be cured. Roughly in a, say, 60 million population, about somewhere around 600 to 700 children may get cancer in a year's time. So how do the children present when they develop cancer? The initial part of the illness, cancer is a silent disease, because always the cancer starts in a single cell, and the single cell has to increase in number. 1 becomes 2, 2 becomes 4, 4 becomes 8, until it becomes big enough to either affect the normal tissues or affect the body function in some way or the other. You don't develop symptoms. So the symptoms of cancer will depend on where it started and how fast it is growing and how it is affecting the normal function of the body. And most of the symptoms of cancer may not be very different from symptoms of any other illness. For example, fever. Fever is a very common symptom. Most of the time it is due to infections. The fever usually lasts for, say, a week, maximum 2 weeks. But whenever a fever is continuing for more than 3 weeks and there is no other reason explaining that fever, cancer has to be considered as one of the possibilities. Similarly, joint pains. If it is unexplained and is ongoing for more than 2-3 weeks, then also the cancer has to be considered as a possibility. If there is any unusual swelling anywhere else in the body, which is continuously slowly growing over a period of time, then the possibility of cancer has to be considered. Say if the child is not behaving normally, suddenly there is a behavioral change, poor school performance, walking difficulties, new development of squint, excessive vomiting which is not getting control and progressively worsening, these can be features of cancer as well. So sometimes children not eating well or losing weight, or there any swelling inside the abdomen or any part of the body can be a feature of cancer as well. How does the cancer gets diagnosed? So first step is that the doctor looking after the child has to first suspect cancer as a possibility, because that is often the first step. So once somebody thinks that this could be a cancer, then the right investigations will be done. So what kind of investigations will be done will depending on how the child is presenting. For example, if there are blood tests may be done for some other reason, say look at fever or some other investigation, and the blood test may show some abnormality, and then because of that then the doctor suspects there could be a cancer as a possibility and then asks for the right test. Most of the time for the cancer to be confirmed you need a tissue diagnosis. So you need a piece of tissue to be looked under the microscope and special tests to be done on it in order to confirm the diagnosis. Which bit of the tissue will be taken depends on where the symptoms are. For example, if there is a lump, we may have to do a procedure called biopsy, where the doctor goes in either by a surgery or by observation through the scans. They will go into the abnormal area and take a piece of tissue, and that is sent for investigations, what we call as a histopathology. And in that they will look it under the microscope, and also they will put some special stains to stain the surface of the cells, which will pick up some specific markers which may be different in different cancers. Those special stains which show what type of cancer it is called as immunohistochemistry. For example, the cancer like blood cancer comes from the bone marrow, which is the soft part inside the bones, and we may have to do something called as a bone marrow aspiration and biopsy, and special tests will be done on that. Sometimes even the blood test will show the evidence of cancer. And cancer in the internal organs, for example in the abdomen or brain, there you may have to do special scans first to pick up that there is some mass or tumor present in those areas. And then once it is picked up by the scans, then some surgical procedure needs to happen in order to pick up a piece of tissue from there to finally confirm the diagnosis of cancer. So what are the different types of cancer which can happen in children? As I already mentioned, the cancer itself is rare, but there are some cancers which occurs more frequently in children than in the adults. One of the commonest cancer in children is the blood cancer, otherwise called as leukemia. And the second common one will be the cancers in the brain, which we call as brain tumors. And there are a lot of other cancers which occurs in different parts of the body. For example, the cancers from the lymph glands called lymphoma, cancers from the kidney called renal tumors, or the cancers from the soft tissues called as rhabdomyosarcoma, cancers from the bone called osteosarcoma. These are some of the examples of some of the common cancers in children. In addition, there can be very rare cancers which occurs even very rarely among the children. So whenever the cancer gets diagnosed, family undergoes a very traumatic period because the first thought comes to their mind is whether they are going to lose the child. Luckily, with the modern medicine, quite a good number of these patients can be completely cured. The treatment may be long, may be arduous, but majority of the children get cured of their cancer. That is one fundamental difference between the cancer in the adults and cancer in children. Because the type of cancer which happens in children are very different from the cancers which happen in the adults, and they are more amenable to treatment. In addition, the children's body is young, the organs are not damaged, they will tolerate cancer treatment much better than the adults. And more importantly, another blessing is that the children don't remember everything. A 3-year-old child who develops cancer, when they are 15 years old, they have a vague recollection of what happened. What does the treatment involve? It depends on the type of the cancer. As a general principle, there are 3 modalities of treatment. One is chemotherapy. So whenever we talk about chemotherapy, they are medicines which affects the cells. The medicines which will prevent the cells from multiplying very fast, and they have particularly tendency to attack the cancer cells. One of the things which I explained to most of the families is that we use a lot of medicines, and most of the medicines are designed to attack something else. For example, bacteria. The antibiotics attack the bacteria and kill them. There is a lot of difference between a bacterial cell and a human cell. So you can design medicines in a way it will only affect the bacteria and it will not touch the human cell. Whereas unfortunately, the cancer cells are human cells. So when you attack the cancer, it is also going to attack some of your normal cells. And that is the reason why we get a lot of side effects with the chemotherapy. The fast dividing cells in the body, especially the cells of your bone marrow, the hair follicle cells which make the hair, the lining of your mouth and the intestine, these are the cells which are normally fast dividing in your body. The chemotherapy will particularly affect those cells, and that is why you develop various complications like hair loss, mouth ulcers, and drop in the counts, that is the red cells, white cells, platelets and all go down during the treatment. But this all can be supported, and by repeating the cycles you can cure the patient of the cancer. The second modality of treatment is surgery. Surgery is an important part of the treatment where the solid organ cancer is involved. For example, a cancer of a kidney or a soft tissue tumor which is arising somewhere. And these kind of situations, the outcomes are much better if the tumors are removed on the whole and there is not much left behind. Most of the time you will need, in addition to surgery, you may need a chemotherapy or radiotherapy as well. Even though the aim is to remove the tumor completely during the surgery, it is not always possible. Mainly because what it is involved and how many vital organs are nearby. So in order to remove the tumor completely, you cannot damage a lot of normal tissues, which will then lead to a lot of morbidity later on. So the surgeon has to make a compromise between removing the tumor as much as possible, but at the same time not damaging too much, which will result in a permanent problems later on. So what if little bit is left behind, that can be taken care of by the chemotherapy, and the next modality which I am going to talk about is the radiotherapy. The radiotherapy is another modality of treatment which is used in cancer treatment. This can be considered as a strong X-rays which will damage the cancer cells. So there are special doctors for this purpose who are called as radiotherapists. So they will plan how much radiation to give, how much area to be covered to make sure that the cancer doesn't come back. There are a lot of newer techniques have developed in the radiotherapy treatment. So with the modern technology, the doctors are able to minimize the amount of radiation outside the area where they want to irradiate, thereby minimizing the long-term side effects of radiation and targeting the treatment only to the area which is affected. So even though I have mentioned all the three modalities of treatment, for a given patient, it may not be necessary that you have to employ all the three types of treatment. Some condition, for example, condition like a leukemia, you need only chemotherapy. And certain conditions, you will need all the three modalities of treatment, and some you may need only two modalities of treatment. So this will be decided on a case-to-case basis and based on the condition by your treating oncologist.